Hi, Kelly and Molly. We can't hear you, which is okay. And we're good to go. So I think we're going to start now. And we have about 2 minutes. Let's just start by introducing then Nicole and Tyler from HealthSpan. We're here with us today to talk about sleep. So welcome and thanks for joining us. And I'll let you guys introduce yourself.
Alrighty, so yeah, as mentioned, so I'm Tyler and this is Nicole. We just recently joined HealthSpan Wellness in Georgetown. We're both naturopathic doctors. So I went to school in London at Western University. I did my undergrad in kinesiology. And then from there on, I went to the naturopathic medical program in Toronto, where I met Dr. Nicole.
Mm-hmm. I did my undergraduate degree in psychology at Ryerson, and then Dr. Tyler said we met at school, and then yeah, now we're at the HealthSpan team.
So I've known Dr. Julia for a while, and we're really thankful for her for allowing us to join the practice, and then also the Glen Studio for having us here today so that we can share some discussions about sleep with you guys. Okay, so we're just going to share our screen here. Screen. Okay, so as many of you may know, we're going to be talking about sleep today. So it starts here. Well, hopefully later today, or later tonight. So I think everyone can see right now, right?
Yeah.
Yeah, okay. Right. So scientists have finally discovered the perfect amount of time to sleep. Just 5 more minutes. It's news, okay. So I thought today we would start off with a little bit of a case example, just so we can get you guys kind of interested in the topic and maybe show what type of person might come into a naturopathic practice with complaints of sleep. So we have ZZ, a 49-year-old female who has come into the clinic with an inability to sleep properly for the last 3 months. She's perimenopausal, so she has irritability, she has hot flashes, and low energy. She works as a nurse. She has 3 12-hour shifts per week at a local hospital. She drinks coffee during her shifts to stay awake and make sure that it's no less than 5 hours before bedtime. Recently, she's been too tired to exercise recently, and naps when she's able to for however long her body lets her. And also, she has been taking a new medication to help with her anxiety. So just keep this case in your heads for now, and then think about it as we go through some of the topics today, as it's related to a lot of the discussions that we're going to have.
So we'll start with just a very general overview of what insomnia is. So typically when we hear the word insomnia, most people think of someone they know who might not fall asleep till 5 a.m., taking hours to fall asleep. It doesn't have to be that drastic to qualify as having insomnia. So by definition, you'd meet the requirements if you have a complaint of difficulty falling asleep, staying asleep, or quality sleep, and that being associated with distress or impaired function. So this just has to happen at least 3 nights a week and last for at least 1 month. So if you've experienced the following there for that period of time, then you would actually qualify as having insomnia. We had a Kahoot game prepared, but we're going to skip that today for time purposes. Just a few general questions. We have like some statistics in there, but we'll go over those in the next slide.
Okay, so here are some general statistics pulled from Canada, and many of them you may not know and are actually a little bit shocking. So around 40% of Canadians actually report insomnia symptoms at least 3 times a week. They're twice as likely to be female. Patients who struggle with insomnia are twice as likely to develop symptoms of anxiety and or depression. You're 7 times more likely to develop a substance abuse disorder. And there's a 10 times increased cost per year in work-related absenteeism and reduced performance compared to good sleepers. There's also increased risk for the development of chronic disease. And so these statistics will kind of go over why they may be occurring and how strategies can kind of overcome this risk. And we'll talk about it a little bit further right now. So
there are several factors that can impact your quality of sleep. One is how efficiently your body is able to complete what we call the sleep cycle. So we'll talk about that in the next few slides of what a sleep cycle actually looks like and how you transition through. There's individual variability on sleep. So you may need 8 hours and your partner needs 6, largely related to genetics, just kind of what people can function off of. And then we have something called the circadian rhythm. We'll talk a bit about that in the next slide as well. And sleep pressure. So basically your drive to sleep. What makes us sleepy? How do we get to that point where we want to fall asleep? Circadian, the word circa comes from about, and then dia is day, and it's largely reflected through your light and dark cycles. So those are the cues that let us know when it's time to sleep, and we can talk a bit about how when those cues get thrown off, how that can disrupt your sleeping pattern. So on the next slide here, we have an example of what the circadian rhythm kind of looks like at a glance. So they're physical, mental, and behavioral changes that follow a 24-hour cycle. So this rhythm influences factors such as hormone release, body temperature, eating habits, and digestion. So you can see here, like at 7:30, for example, melatonin secretion drops. Your highest alertness will be at 10 a.m. So there's just a natural process of our internal clock that we follow based on light and dark. So shift work or jet lag can drastically affect this light-dark cycle. And light from electronic devices, you may have heard of blue light before interfering with sleep. So being on our phones, computer, TVs really late at night, that's putting light input into our eyes, into our brain, and confusing our internal clocks. And then we can catch up to that clock. Let's say you've traveled, you're experiencing jet lag. After a few days, the sun and the dark, you'll kind of catch up to that. But if you're doing shift work, for example, like you're a nurse, like in our case study there, it's much more difficult because most people are going to sleep when the sun is up. They're leaving for work when it's dark. So you're very disconnected from that natural rhythm that the body wants to follow.
And these types of things on this graph are mostly influenced by sort of external factors, is what we call it. So affecting like day shift work, your exposure to light and stuff like that. So there's certain categories that are related to insomnia. So our external factors that we talked about, and there's also internal factors, which we'll get into a little bit, which involve our hormones, maybe genetic health-related things like mental health, anxiety, and stuff like that, which may take a little bit more work. But these are things that can be, talked about right away in a naturopathic appointment.
Mm-hmm. Yeah, they're easily modifiable. So moving on to our next slide.
Let's see, it might have froze.
So this is a general overview of what a sleep cycle looks like. So we have 5 stages. So starting from very light sleep going into deeper sleep. So the first stage is you're drowsy for about 10 minutes or so. This is right before you fall asleep. Your brain waves are starting to slow down a little bit. Then we move into light sleep, which lasts about 20 minutes and so on. So we move through that cycle. So moving through stage 1 through 5 counts as one full sleep cycle. So on a typical night, the average person will go through 4 to 6 sleep cycles. So this is just kind of an overview of what that looks like cumulatively. So we've gone through 4 to 6 sleep cycles. That equals about 4 to 7 hours per night of light sleep, and then 1.5 to 2 hours of deep sleep. And so you'll notice here a word REM, so REM sleep. We'll talk about that in the next slide. So REM sleep stands for rapid eye movement. So it's actually little light flutters of the eye. This is where we're dreaming. So we spend 20 to 25% of our sleep in this cycle, and it peaks in the morning, which is why typically when we wake up in the morning, we remember our dreams in the morning. The non-REM sleep has more substages, so they have slow wave or delta waves. It's just a different type of brain wave that we experience during this time. So that's relevant because through those different brain waves, our brains will be doing different things, whether that's creating memory. So if we learn something throughout the day, that's where we're going to kind of make that concrete so we can go retrieve it later on. We wake about 4 to 6 times a night as we shift from these cycles. So when we say wake, it's not a true waking up. You're just going back into that lighter stage. And studying these cycles helps us determine how good your sleep actually is. The deep sleep is important because that's where we're going to recuperate and regenerate. If we worked out, that's where we're going to release growth hormones for muscle gain and fat loss. So that's really important. If you're not getting that really deep restorative sleep, some people stay in those really early stages of sleep. So they wake up unrefreshed, even if they're getting 8 hours, because they're not getting that restorative sleep. It's also where we're going to restore our neurotransmitters like serotonin, so our happy hormone, dopamine, our pleasure hormone, and so on. We're going to talk about everyone's favorite, naps. So I'll let Tyler talk a bit about that.
Yeah, so a common thing people often ask about is, are there any consequences to napping? Often speaking to your friends, family, sometimes people, oh, I love naps, I can wake up, I feel refreshed. Other people say, oh, I feel so drowsy, I just can't get up afterwards and it ruins my day. But we have a nice little infographic here posted. And it's basically saying like how long to nap. So you can look at the picture. So in the green boxes in the top left and the bottom right, basically says, so in 10 to 20 minutes, it might boost your energy, it might be easier to wake up. And that's because you haven't set into that sleep cycle that Nicole was talking about on the previous slide. And then on the bottom right-hand side, 90 minutes is your body has gone through a full sleep cycle and you've gone out of that deep sleep and you've a lighter sleep, and it's easier for you to wake up. So you're able to regenerate some of those neurotransmitters and regain some of the function that you're actually looking for. So if people wake up groggy and unable to function throughout the day, they may be sleeping around half an hour. So in the top right-hand corner there, or maybe an hour. And so they're stuck in that deep sleep and they haven't gone through that sleep phase cycle. So let's say you're a very early riser, you wake up at 5 in the morning and your day is done at 3 o'clock and you have kids to cook for and other functions throughout the day, that might be beneficial for you. But a lot of people who are struggling with insomnia, you can't sleep at night, daytime napping may actually impair your ability to fall asleep at nighttime and actually have a restful sleep at night. So it's something to play around with, but definitely interesting. It's good to note.
Yeah, so we'll show you a bit about what that looks like when we have a normal sleep cycle disrupted and when we take naps. So this concept of sleep pressure, it's promoted by a molecule called adenosine. So that accumulates in the brain over the course of the day. It's our sleepy neurotransmitter. So it naturally builds throughout the day. And then once you get a high enough buildup, that's going to prompt you to sleep. You've built enough sleep pressure. And now I'm sleepy enough that I can go to sleep without having a delayed sleep onset. So certain behaviors can deplete that buildup that your body's been working hard to create throughout the day. So if we think of adenosine buildup as like filling up a cup of water, you're building up that adenosine. Once you get to the top of the cup, then you're going to fall asleep. Daytime naps will pour the water out of the glass. So it's taking out all that buildup that you've created. And then drinking coffee prevents water from going into the glass because it competes to bind at that receptor. So you're not getting that sleepy buildup. So you can see here in this graph, like this gray bar is sleep. So this is the normal sleep pressure, 7 a.m., adenosine's building, reaches a peak, and then we go to sleep at 11, we repeat the cycle the next day. If we don't sleep one night, then that curvature, it's not as sharp of an incline, it's more of a slow progression. And the next night, once you go to sleep, it should reset itself. If we're taking naps, then you can see this spike and drop here. So this person has been building, they take a nap at 5 p.m. Now they're getting that drop in adenosine. You have to build it up before you can go to sleep again. So this could actually shift their curve. Instead of going to sleep at 11 p.m., they might be going to sleep at 1 a.m. because it might take longer for them to get enough of a buildup. And then in the next slide, Dr. Tyler will talk a little bit about how poor sleep can affect our health.
Okay, so here are a few health conditions that may be related to poor sleep. And so one thing we can talk about is mental health. So as Dr. Nicole was talking about in the last few slides, neurotransmitter buildup. So those happy hormones like serotonin and dopamine are all regenerated in those deep wave sleeps. And if somebody is disturbed by external factors, let's say their partner wakes up early, or it's a noisy neighborhood, or there's light pollution, they're not getting into that deep wave sleep. And so disorders such as anxiety and depression can be aggravated if you're not sleeping. And that's something to definitely screen for in patients who are coming in for mental health concerns. So also your metabolic health. So diabetes, heart disease, high blood pressure, and obesity are all associated with poor sleep. And so Nicole will talk about it in the next few slides, but it's actually a U-shaped curve on a graph. So let's say 6 hours to 8 hours is on the bottom. So you get more health concerns if you sleep less than 6 hours. And also it's related if you sleep longer than 8 hours. So it's not just less sleep, it can be more sleep that can be contributing to these conditions. And we'll talk about that a little bit in the next slide. But pain is also interesting. So we had sustain an injury. If we're experiencing a lot of pain, obviously that's probably going to disturb our sleep if we're awakening due to shocks or nerve entrapments and pain like that. But disturbed sleep also decreases your pain threshold. So if you're not sleeping very well, your ability to perceive pain also increases. So certain like little aches and pains are going to drive you crazy at nighttime. And so it creates this vicious cycle that's really hard to kind of combat. And yeah. Okay.
So this is a study done on the relationship between sleep duration and chronic diseases. So it's really interesting here. I've included both graphs. So what they did is they looked at sleep duration in different patients. So you'll notice there's a top graph here of obesity and a bottom graph of obesity because they've done it in two different populations. They compared it by gender in this first one, and then they compared it by age on the second one. So on that first graph, the green line represents female individuals. The blue line is male individuals, and then that red line is just an average that they've taken from both. On the bottom here, the red line is individuals from 18 to 64 years of age, and then the green line is those who are 65 plus, and then again, that blue line is just an average. So it's interesting because you can look at the two and kind of compare what your risk would be. So for obesity, if you're sleeping less than 5 hours, as a female, your risk is a lot higher than if you're a male. You can see it's lower there. That blue line is for male, the green line is for female. And then once we're at 7 hours here, your risk is the lowest. And then it starts to increase again as we approach up to 10 hours. It peaks again. Still not as strong of a risk as if you're sleeping less than 5. So this is that U-shaped curve that Dr. Tyler was talking about. You have an increased risk, it lowers at around 7 hours, and then it increases again as you increase the amount of hours you're sleeping per night. So they have this for obesity, depression, diabetes. I included all of them here just if someone's concerned with their individual risks, they can look through and say, okay, so asthma, I'm a female, so green line, there's my risk, and then I'm actually 65 plus. So you'll see that although your risk is increased if you're female, if you're 65 plus, it's actually reduced. You have a higher risk if you're in that 18 to 64 category for asthma. So it can kind of outweigh itself sometimes, which is nice. And then we have the same for kidney disease, heart disease, and stroke. And now Tyler will expand a bit more on sex differentiations and risk as a female.
Right, so we'll talk a little bit about the female perspective and sleep. And so research has shown there's a familial predisposition to sleep disorders. So like mother, like daughter. And so mothers who have struggled with insomnia, often their daughter will also struggle. So there's a stronger correlation on the maternal side compared to the paternal side. So research has shown it may be genetic, but also if you think about it, it could be just familial. So passing down family traditions and stuff like that. If one side of the family, takes on more burden, because often that does happen in a lot of families. Like the mother will work, she'll cook, and she'll take on a lot of responsibility. So that's also another area that we're looking into. And then during the menstrual cycle as well. So females who struggle with PMS, their sleep is disturbed significantly 4 days before and a few days after as well. And so controlling those symptoms and helping that will often help get women back onto a regular sleep cycle. And pregnancy, so lots of changes in pregnancy, right? So we experience weight gain, different food cravings, our hormones are driving up like crazy. If you think about it, like certain estrogen hormones, like the weaker ones, are 1,000 times higher during pregnancy. And so you can just think about how that will affect your metabolism overall and sleep. And so after pregnancy, we also continue to see some of these struggles. So often weeks pass and these sleep struggles are still continuing, and they don't actually regulate until the baby's circadian rhythms, so their light and dark cycles, actually sort of regulate as well, but it still takes some time. So it's definitely something that we like to help out with and like to work with. And then menopause as well. So perimenopausal, menopausal, we start to see these what we call vasomotor symptoms. So we get a little bit like hot flashes, heat intolerance, irritability at nighttime. And yeah, same with pregnancy, we're getting an increase in hormones, and in menopause, we're actually getting a decrease in hormones. So that's really affecting the way that our body can sleep as well. Yeah. Okay, so cortisol. So cortisol, our stress hormone. So fight or flight. So in a situation where stress, protecting our family, what have you, cortisol is boosted. Acts on the liver, it secretes glucose for energy, stuff like that. So it's often an interesting hormone to look at if we're assessing patients' fatigue, your inability to sleep, their food cravings and stuff like that, because it has such an impact on your metabolism. And then, so what we have down here are just a few graphs kind of describing how cortisol can kind of affect the way that we have food cravings or sleep issues and stuff like that, and how it can all be related. So on the normal graph, you see here, we have an initial spike of cortisol. So the little black dot is just indicating that. And then so we'd like to see that around 6, 7 a.m. If you're waking up, we have that initial spike, release of sugar, ready to go, ready to take on the day. And then what will happen is it will gradually go down. And then by 21 or 9 o'clock at night, it's very low, sugar's down, we're ready to sleep, ready to take on the next day. And then what we have here, next little graph here, is chronic stress. Yeah, question.
So if you're getting up by an alarm clock,
yeah.
So you're not kind of reaching that level before you wake up. So
yeah, you could be stuck. Yeah.
How does that affect you?
Yeah, so I don't know if it happens with you or people that that it just takes them a really long time to get going, and so they rely on caffeine to get them up in the day like that. So what you want, like naturally, is you just want to wake up and like, you're good to go, like you're ready to go, right? So if you're woken up by an alarm, your body will adapt, but it's not ideal, right? So then what could happen is these next stages is where if you have chronic stress, so we talked about the fight or flight, cortisol being pushed. If you're dealing with chronic work stress, family stress, other types of stressors, non-natural stressors that we're not normally supposed to be exposed to as humans, we can have a delayed increase in cortisol. So you see how the black dot has shifted, and it's around like 9 a.m. instead of around 6. And so what often will happen, well, people will resort to stimulants to kind of get them going. And what that creates is sort of an inefficient pattern. And then you don't get that natural decline in cortisol. So you see around 9 p.m., it's actually elevated a little bit. So if you have elevated cortisol, you may have like sugar cravings at nighttime, inability to sleep. You might have mood regulations, or irritability and stuff like that. So that's something we can look further. If this is happening for years on end, then we can move into a stage of like chronic fatigue. So we still get the delayed cortisol in the morning, and we may get significant drops that occur early in the day. So you get basically hit the wall earlier, and you're not able to get yourself through the day, and you just chronic fatigue basically, right? So you may need to be napping, or feel like you may need to be napping. Exercise, you don't get that cortisol, so exercise actually makes you feel worse, and this will affect your sleep. And
expand on that a little bit. So this like chronic fatigue or burnout stage, people feel like they're just like dragging their body throughout the day, like they just never feel energized. Their cortisol never reaches an optimal level throughout the day. It's always so low that you just never have that period of the day where you feel like, okay, I'm ready to get things done. It just doesn't get there. We can actually test that as naturopaths. So you can do that through dried urine samples. So you can actually see if you have optimal cortisol, because sometimes people have trouble differentiating, do I have too much cortisol? Am I too stressed? Or do I not have enough? Typically, when you have too much, you're going to feel anxiety, you might feel heart palpitations, sweating, you're going to get more of those physiological reactions to stress. Whereas when you're burnt out, you can feel numb, depressed, super fatigued.
Blunted emotions.
Yeah, blunted. You're pretty flat once you get to that point.
Cool. Okay, so next, human performance. So it doesn't necessarily apply to just athletes, but this is anybody who is looking to, have a more physically fit body, or just increase their exercise activity or lifestyle. And so sleep is directly linked to increased injury rates. So a lot of studies follow university athletes, and they'll follow the teams throughout the year. And a number of studies that I found, they actually almost doubled injury rates for participants on those teams who got less than 6 hours of sleep before game weekends. Because a lot of the teams in the US, they'll have weekends or games on weekends, and then if they're not sleeping, it actually associated with significant increased injury rates. And as Dr. Nicole was talking about before, if you don't get into that deep sleep cycle, the growth hormone that's released steadily throughout the night is actually decreased. So you don't get those molecules that help with recovery. You also get impaired reaction time and impaired decision-making. So this can apply to work life, driving, any part of life that you need to make those quick reaction times. And also athletes, prolonged concussion recovery, and you actually get more severe symptoms if you're not sleeping and recovering. So you need more sleep in that sort of stage to repair, right? And also medication side effects, such as drowsiness and decreased alertness. So sometimes people will take the Benadryl or stuff like that. You actually build tolerance to that over time. So it's not actually a good thing to take in the long term. And then medications, we won't get into this too much just because it's more so a personal discussion between your family doctor or your naturopath. But some people wonder, hey, are these new medications that I'm taking, are they contributing to my sleep? And the answer is it may actually contribute to inability to sleep. So certain antidepressants, hypertension medications, nicotine, especially, or stimulants, based on the timing that you're taking them, may actually contribute to your insomnia. So like ruling this out is one of the first steps to take with a primary provider and your patient. And so your family doctor, your naturopathic doctor, we can work together to kind of help out to see, hey, do there need to be changes or maybe some adjustments that need to be made. And these are just some tools. I'm not sure if you can copy the links or something, or maybe we can send out something afterwards. But if you're interested in talking to your family doctor or naturopath, you can download the sleep diary. So basically you can take like a week's worth of your sleep. And it's one of the most important things to provide at your initial visit, just to get a great idea of like how you're sleeping. And then there's also a link to 24-hour movement guidelines. So this basically just describes screen time and exercise and how to create that sleep pressure, right, that we talked about. So exercise is a great way to increase that molecule adenosine and build that sleep pressure and fill that glass so that it's full, so that we're able to sleep at nighttime. And then we can talk about this sleep hygiene, which is very important, right?
Yes, so sleep hygiene, these are like the behaviors that we do to help us initiate sleep, or kind of the parameters that help us sleep best. So having a cool room, ideally 68 degrees is best, complete darkness, no eating a minimum 2 hours before sleep, because then we're digesting and that's taking a lot of energy being sent to our digestive system that is going to basically prevent us from initiating sleep. Minimal electronics, as you mentioned earlier, with that blue light coming into our eyes. You can get blue light glasses, so you can get blockers. If you work on a computer all day, if you're working till maybe 6, 7, that can help reduce some of that blue light going in. It's still not ideal that we're on electronics that late, but it can at least block a little bit of it from coming through. Daily mindfulness practices. So yoga has been found to improve insomnia, severity scores, and menopausal symptoms after 4 months of practice. So that's something nice to add into your exercise routine. And then consistent exercise, so heart rate elevated 3 to 4 times per week, that will help with sleep. No caffeine after 12 p.m. Dr. Tyler will talk a little bit more about that in our next slide, but there's a lot of sleep hygiene things that you can do to help optimize your sleep. Another one being not doing things in your bed that aren't sleeping. So if it's not sleeping or sex, then it shouldn't be happening in your bed. So no working. If you're gonna nap, then ideally napping on the couch, because we have something called like a paired association. So your brain can make associations and behaviors based on its environment. So if I'm taking a nap for an hour, then my brain is going, oh, we sleep here for an hour, right? And then I go to sleep and my brain's confused because we do short sleeps here. We don't do long sleeps here. So it can get kind of tricky when you're doing anything in your bed that is not sleeping or sex. So it's best to just leave those two to the bedroom. Anything else, if you have to do work, do it in an office, do it on your couch, your kitchen table, but just not in your bed. And now Dr. Tyler will expand on the caffeine, going back to the case that we discussed earlier, where she's drinking coffee throughout the day.
Right, so yeah, as you mentioned, just to keep that case in your mind as we work through the PowerPoint, but so perimenopause, we talked about hormonal fluctuations. We can't literally talk about any treatment recommendations today, but often in naturopathic practice, we can kind of get to the root cause of why this may be happening and what things that we can recommend to help kind of regulate those symptoms. And then, so irregular shift times, right? We talked about circadian rhythms. So especially as a nurse, if she's working from 3 to 3 one day, and we have to kind of provide tools for her to kind of get back, influence or help with those external factors that we talked about, which are affecting her circadian rhythm. So drinking coffee. So she made sure that she did not drink coffee less than 5 hours before bedtime. So let's say she goes to bed at 12 a.m. She makes sure she has her last coffee, her last sip at 7 p.m. So we can talk about half-life for a second like that. So half-life is the amount of time it takes for your body to eliminate half of a drug. So caffeine is a drug, right? A lot of us are addicted to it. And then, so let's say there's 150 milligrams of caffeine in your system at 7 p.m. So it will take 5 hours for your body to rid half of that. So at 12 a.m., you're still going to have 75 milligrams of caffeine in your system. And then so another 5 hours goes by, so 5 a.m. So 75, half that. So math, 37.5 grams of caffeine in your system at 5 a.m. So another 5 hours at 10 a.m. the next day, you're still going to have half of that 37.5 in your system. So a lot of people think, oh, it'll be out of my system within 10 hours or so because the half-life is 5 hours. But for a typical person, it actually takes 24 to 36 hours to get caffeine out of your system. So somebody who's struggling with insomnia, it's probably one of the most important things to look at is when you're having your caffeine. And some people are slow metabolizers, so which that means their liver, it takes them a little bit longer to kind of rid things from their system. So it may take a 9-hour half-life, so it almost doubles. So it may be 2 to 4 days before you actually have caffeine out of your system.
Mm-hmm.
And then so we talked about napping and sleep pressure and exercise. So she's been too tired to exercise recently, so she's been napping. But what she should actually be doing is doing whatever she possibly can to exercise during when she's tired in order to create that sleep pressure and remember boost that adenosine in the mind and in the brain in order to kind of fill that glass to make sure that when it is nighttime, her eyes are heavy and she's ready to sleep. And then, yeah, she also switched medications recently. So there are certain medications that are for mental health concerns that are actually very energizing. So depending on when you're taking them and how you're taking them, it's something you can talk with your family doctor or your naturopath to see, hey, like, is this something that I can change or switch or to kind of come up with a good plan to help with sleep disturbances. Yeah. So it was around 30 minutes. I think we're done all our content today. Any questions? No.
What about tea?
Tea.
Instead
So
of coffee.
herbal tea?
Yeah. No. Like
Black tea?
tea.
Black tea, yeah. So there's less caffeine, but some black teas can have almost as much caffeine as
Mhm.
coffee, right? So the caffeine is the same molecule, right? So it still takes that amount of time. But if you're talking about like green tea or like matcha tea or something like that, there's a combination in there called theanine. So it's basically a very relaxing molecule, and it stretches out how caffeine is absorbed in the system. So it may create like a calming alertness. So it might be something a little bit better for somebody to try versus coffee.
Yeah, it's why people will think that there's less caffeine.
Yeah.
In something like green tea, because that theanine is compensating for some of that kind of like jitteriness that you can get with a coffee. But they can have the same amount, or if not more, some teas can have more caffeine in them than a coffee.
And then we had a question about if our NDs in Ontario are covered by health plans, and our appointments are covered by most comprehensive health plans. So, yeah.
Any other questions?
So it's 2 in the morning and you're wide awake. You woke up, you're battling, how to go back to sleep.
Yeah, so I can talk a little bit about that. So a lot of people will just try and fight it. They'll try and convince themselves, okay, I'm closing my eyes, I'm going to fall asleep eventually. But I think one of the top recommendations is to actually get out of the room and go do something. Because that will kind of drive the sleep pressure. Like your body will kind of understand, hey, like this is 2 in the morning. I'm not supposed to be downstairs in the kitchen. This is when I'm usually ready to go, right? So do something for half an hour or however long it takes you to get tired, and then go back. Don't go on your phone, look at emails, try and get work done, because then that convinces your body, okay, like cortisol, here we go, ready to take on the day.
Yeah,
Yeah.
something like a light reading, nothing too crazy, no textbooks or anything. Even something that you don't like doing, like if you would rather be sleeping than folding laundry, go fold a couple of shirts, and then you're like, I'm going to bed, I don't want to be doing this. yeah, Dr. Tyler's right. Getting out of bed is helpful because then it's back to that paired association of, okay, I'm in my bed and I'm not sleeping, and then that becomes the new normal for you. There are other things we can do, like talking about sleep hygiene or herbs, acupuncture to prevent you from waking at 2 a.m. if that's something that you're experiencing pretty regularly. If it's happening like every night at the same time, then usually there's some things that we can do around that to prevent you from waking at all. But yeah, getting out of bed.
What about alcohol? If you have a glass of wine at dinner, then it makes you sleepy, and then it affects, and then you wake up.
Yeah, so
Talk about alcohol.
definitely impairs your sleep cycle. You're not going into those deep stages of sleep when you're having things like alcohol, THC. So a lot of people use marijuana to help them fall asleep if they have chronic pain, but that will prevent things like dreams. We're not getting into that stage, and you need that stage to get that deeper sort of sleep. Part of the alcohol association can also be your liver's metabolizing. In Chinese medicine, your liver is connected to sleep. It's connected to like that 3 a.m. time when people wake up. So if you find you're waking up that time, can be connected to liver, not in the it's interesting to explain because we have our physical liver, and then Chinese medicine is more of like an energetic thing, but they kind of parallel each other. You're metabolizing alcohol in your physical liver. Your energetic liver is waking up at the same time. There's a connection there, and you have impaired liver function energetically, sometimes physically around menopause. So a lot of women find that they're waking up at 3 a.m. tends to be the common time, or like 3 to 5 is when they find they're waking up and they can't get back to sleep. So there's a relation between those two things there.
Yeah, and once your body starts to clear it out, your heart rate goes up. So you're clearing out the alcohol, you're metabolizing that. So you get the certain chemicals that are released, and basically your physical metabolism increases, heart rate goes up, and awakenings. And and you're in that light sleep. So you're not necessarily getting into that very deep sleep.
Yeah, body temperature will increase. We need that lower body temperature for deeper sleep. So your heart rate's going up. So
Right.
Yeah.
there's a lot
If you
going
have
on.
alcohol, your heart rate goes up.
Yeah, so not necessarily the best for somebody who's struggling with insomnia to have a nightcap.
Right.
Probably schedule it a little bit more, a happy hour, I guess.
Right.
you'd say.
Yeah.
Yeah.
So we do have, sorry, one little plug here then, is we do have having a message from Balance Acupuncture who does actually go on the class here.
Oh, wow.
Too.
Yeah,
So
that definitely
learn
helps.
something.
Yeah,
Yeah.
that'd be
Yeah.
great.
Excellent.
Yeah, lifestyle techniques, exercise is one of the best things, right? So
Right.
meditation, stuff like that. So awesome.
You were talking about keeping your body cool.
Mhm.
With this weighted blanket, is that just a fad right now, or is that help?
It depends. If the individual preference, do you like to be covered or uncovered when you sleep? Most people like something. The weighted blanket will help kind of calm their nervous system because it kind of acts like a hug for a lot of people. So if you find you need that to help soothe in a way, then it can help. But if you're too hot with the weighted blanket, then it's working against you. So it depends kind of the temperature of your room, what you can tolerate, that sort of thing. Generally, those blankets don't get too hot. Some of them have like some cooling technologies in them, so you don't feel like you're getting
Like
too
a gel
warm.
pack or something, like a gel, no?
Yeah, I think they have something in there, so it's not like it's like a thick quilt, but
Great. Cold room, hot blankets.
Well, I don't want a hot blanket, but
yeah.
cool.
Yeah.
It's just like when I was in Calgary, my girlfriend threw that on me. I really enjoyed it.
Yeah.
Cool.
Yeah, if you like it, then and you're
Yeah.
not getting too hot at night.
Yeah, the nervous system, right? So the autonomic nervous system, like your sort of resting nervous system kind of activates. So there's technologies for dogs that are called like thunder vests, right? So if they're terrified of thunder, you can wrap them in a weighted vest and stuff like that. And also children on the autism spectrum kind of brings them back down if they're very elevated.
Yeah, if they're overstimulated, it
Yeah.
kind of helps calm their
Yeah,
system.
that's what I did hear about them.
Mhm.
Cool.
Great. So maybe what we'll do is we'll, when I when I get the recorded link, I'll send it to you and I'll send it to the people in the gym as well. And anyone else who requests it, and I'll put on your details and your names and healthspan's address. And the links that you talked about, we'll include that. And then I'll include Heather's actually away for holidays for a couple of weeks, starting back here on November 15th. So we'll send details of the Qigong class as well. And if there's anything else you think we should include, we'll send that out as well.
Thanks for everyone for joining.
Mhm.
Well, thank you for coming. That was really informative. And this is something we get talked to about a lot here at the gym. So that's great.
Yeah, happy to provide some, beginner information.
Mhm.
Yeah, that's great. Good, good. Okay, well, thank you.
Yeah.